Again, good afternoon. Welcome to all of you. First of all, I would like to thank all of you for the attention you are attaching to this theme and to the high ambitions of this summit for global health. I would like to apologize for some shortcomings for the limited number of accreditations and the short time, but this is one of the first summits that is being organized in presence after COVID, and I hope the shortcomings will be offset by the beauty of this place and by the historical and artistical cultural heritage we have here. Now I'd like to give the floor to the Minister of Health from Italy, Mr. Roberto Speranza. Well, thank you. I'm sorry there is no microphone. Thanks to all of you for the work that you have done in following the summit. And I am sorry, but there is no sound in the booth, in the translation booth. Non c'è suono nella cabina. We are very sorry, but there is a technical problem. We cannot translate because we don't have the sound in the translation booth. We are very sorry. They are trying to fix the problem.
Che vuole camminare insieme e che vuole provare insieme a vincere le sfide che ci sono di fronte a noi, la sfida del Covid, ma io direi più in generale la sfida del rilancio dei nostri servizi sanitari nazionali e delle politiche della salute. È un documento molto articolato quello che abbiamo sottoscritto, il Patto di Roma. È un documento, lo ribadisco, firmato da tutti i Paesi che su questo documento hanno superato le differenze che pure ci sono naturalmente di storia, di cultura, di provenienza religiosa e hanno deciso di impegnarsi per rafforzare i nostri servizi sanitari nazionali. I punti essenziali quali sono? Lo dico veramente in pochissimi istanti. Prima di tutto quello di provare a trasformare questa crisi in un'opportunità. La crisi di questi mesi ha messo a dura prova i servizi sanitari nazionali di tutto il mondo. In ogni paese abbiamo vissuto gli stessi problemi. Vivevamo a migliaia di chilometri di distanza, ma alla fine i temi con cui ci siamo confrontati sono stati gli stessi e quindi è la vita che è stata più forte dei chilometri che ci ha unito e ci ha fatto diventare un'unica grande comunità di destino. E allora il primo grande punto è ricominciare ad investire sui servizi sanitari nazionali. I servizi sanitari nazionali sono la cosa più importante che c'è. Chiudere definitivamente ogni stagione di risorse scarse o addirittura di tagli e investire nuove risorse rilevanti sul nostro sistema di sanità pubblica. Con quale spirito? L'indicazione di strada di questo documento è molto chiara. Noi vogliamo difendere l'impianto universalista, cioè l'idea, voglio ribadirlo, che se una persona sta male non conta quanti soldi hai, non conta dove sei nato, non conta il colore della tua pelle, non conta di chi sei figlio, hai diritto ad essere curato. Questo è l'impianto che noi abbiamo voluto affermare con ogni energia e con ogni forza. E poi abbiamo insistito ancora sulla One Health
And then we insisted on the One Health strategy, One Health. The idea that human health, animal health, environmental health are interconnected. It is not possible to divide them. So humans cannot live well in a world in which animals and environment are not living well. This is a strategy that we have shared and on which we want to commit ourselves with all our energies.
Ancora lavoreremo chiaramente sul grande tema di questi giorni, che è naturalmente il contrasto al Covid. Il Covid è ancora un nemico insidioso. In tutti i nostri paesi facciamo i conti ancora con contagi con ospedali che hanno livelli sicuramente diversi di pressione, ma hanno delle forme di pressione e ancora purtroppo decessi. E quindi la prima battaglia delle prossime ore non può che essere quella contro questo virus, contro il Covid. E abbiamo uno strumento che per noi è lo strumento fondamentale, la vera chiave per chiudere questa stagione è la campagna di vaccinazione e i vaccini sono la chiave per provare ad aprire una stagione diversa. Abbiamo condiviso che in queste settimane, le prime di una lunga campagna che si svolgerà a livello globale, il livello di disuguaglianza è un livello troppo alto. Io penso che sia un livello non accettabile, non sostenibile, sbagliato sul piano valoriale, ma anche sbagliato sul piano sanitario, perché se lasciamo una parte del mondo senza vaccini, rischiamo di avere ulteriori varianti che potranno rafforzare la sfida di questo virus contro di noi. E allora il nostro messaggio, il messaggio del patto di Roma che tutti i paesi hanno sottoscritto, è un messaggio molto molto chiaro. Nessuno deve restare indietro nella campagna di vaccinazione. I paesi più forti, i paesi del G20, devono farsi carico di aiutare i paesi più fragili nella campagna di vaccinazione. Questo va fatto subito, qui, adesso ed ora. Io non voglio aggiungere altro, ma se non la mia personale soddisfazione, perché sono stati giorni molto intensi, giorni veri di discussione, di dibattito, giorni in cui però da Roma arriva un messaggio fortissimo al mondo, che si vuole camminare insieme, che ce la faremo, che vinceremo questa sfida e che i servizi sanitari nazionali sono davvero la cosa più importante che abbiamo su cui vogliamo costruire il nostro futuro. Grazie.
Thank you. Now we have some questions. We have about 30 minutes. Please ask short questions. Gerardo D'Amico from Naira News 24. Good afternoon, Minister. I would like to ask you, so Gavi and the different organizations that distribute vaccine with $2 billion, it would be possible to have the possibility to meet the vaccination requirements of developing countries. Today, the General Director of the WHO has been very clear, saying that there are unacceptable disparities. So some funds have been allocated by the G20 to try and make these commitments concrete. And I would like to ask you, since this is the first pandemic in the era of the social media, and the WHO talked about infodemics, so in order to deal with future pandemics, the coordination, scientific coordination you announced, is it going also to work in the field of communication?
Allora, intanto colgo l'occasione, l'ho fatto già ieri, ma lo ribadisco oggi, anche per esprimere solidarietà al dottor D'Amico in modo particolare, che è stato coinvolto da un'invettiva social da parte, diciamo, di gruppi che io credo siano inqualificabili, perché quando si usa la violenza, anche solo verbale, si è sempre di fronte a qualcosa che va condannato. Sì, le indicazioni di Gavi e delle altre istituzioni internazionali vanno in quella direzione, sono quelli i numeri indicati. Però io voglio dire con chiarezza quello che penso. Noi dobbiamo assumere impegni di bilancio, ma poi gli impegni di bilancio non possono diventare una camicia di forza. Io l'ho detto in altre occasioni, è la quantità di diritto alla salute che dobbiamo tutelare a decidere le cifre e i numeri dei nostri bilanci. Non è che noi mettiamo una cifra e poi siamo vincolati a quella cifra, e se quella cifra non dovesse bastare ci possono essere comunità che restano senza vaccino. No, si parte dall'obiettivo politico e istituzionale.
Well, will resources not be enough? Well, the countries of the world have become committed. We have written very ambitious targets in this 30-point declaration, but our work does not stop here, because in fact there will be a meeting of Ministers of Health with the Ministers of Finances, and this will be another decisive moment in which we have to identify specific resources in order to fund all the instruments that we want to make available, international instruments that have been developed through our network. Communication is one of the points. Now we have a scientific community working together, which is interconnected, and the same WHO in all the documents has indicated that communication is one of the aspects of preparedness. So it's clear that even from this point of view, we have to take a step forward, trying to share an approach in order to provide the international public opinion the right messages. Another question for TG2. Yes, good afternoon. I would like to know what about the waiver of intellectual property rights and technological transfer for the production of vaccines? Have you found a common solution? And then another question about gender medicine. What are the points that have been accepted and the requirements that have been raised by the G20 women? Well, this was a highly debated issue. This is a hot issue. I know we started from different positions. We share the basic objective because the objective is to bring vaccines to every corner of the world and to facilitate their production, because today vaccine production is limited to some areas of the world. Instead, we believe that in order to launch a mass campaign, we need to bring this production into all geographical areas and not only to some areas of the world. So our commitment is going in this direction. As to gender policies, within the text there is a very strong reference to gender sensitivity, which is very important, and we are committed to doing more. As you know, there are different approaches to this theme, but there is a basic principle, and in the text we've managed to indicate a path that is absolutely the right one, but we have to strengthen it even more. Personally, I believe that G20 and all the other international organizations have to consider this text just a starting point, and then we'll have to do much more as far as I'm concerned. From Reuters. Good afternoon, Minister. I would like to ask you whether you can better specify what is the aid that you want to provide to countries that has not had enough vaccines. So what are you going to do? Are you going to increase investments? Are you going to increase exports? Well, that's an action with different kinds of lines. For example, the strongest countries, especially the G20 ones, are committed to allocating significant resources and to sending vaccines directly to the most fragile countries. This is already happening. We are doing so in Italy. In fact, this is being done by other countries of the world. We have to strengthen this commitment. This is a bilateral commitment. Some countries decide to intervene, and also through international instruments starting from COVAX. Moreover, we want to create the conditions so that production can be brought to other countries, because it is not enough to transfer doses, which is right, that we're doing and that we want to intensify, but we really have to make other areas of the world capable of producing, which means that we have to share methodologies, processes, so that different areas of the world will be able to produce vaccines and have a greater autonomy. The question is from Sky. Good afternoon. First of all, was China present physically? In presence, China was connected online. They have intervened. And personally, I had a bilateral meeting with the Chinese minister before the beginning of the G20. My question is on Italy. It seems that our young people have fully responded to the appeal of the President of the Republic that becoming vaccinated is a civic and moral imperative. But there are 3.7 million people above 50 years of age that are not being vaccinated. What are your plans to convince these people to get the vaccines? Well, first of all, I really appreciate the message that our countries are giving. This is a message for themselves, but also for all the other generations. So young people, better than others, have understood the vaccines are the true key to freedom in order to close this season and open up another. And even in informal discussions with other ministers from European countries, the signal is very similar. So at the beginning, many thought that young people would be reluctant to be vaccinated, also because they don't have a high risk of having heavy COVID consequences. But the message is the opposite. Young people are being vaccinated more than other age groups, and I believe this is a very nice message. I agree with the words of the President of the Republic that he mentioned yesterday. They're very strong words that I appreciate, and I believe that they fully represent the spirit with which we are trying to carry on our vaccination campaign. So we have positive figures in terms of vaccination, thanks to Commissioner Figliuolo, the leader of the vaccination campaign. But we have to increase the number of vaccinated people. There is a discussion that is taking place that will probably lead to take some decisions in order to strengthen our campaign even more. I'm thinking to extend in the Green Pass as announced by the Prime Minister Draghi, and also I'm thinking of other hypotheses that will allow us, if necessary, to strengthen our campaign even more. We have a question from Radio Rai. Yes, good afternoon. My question is, do we have enough data, especially looking at Israel, which is a laboratory, of the vaccination campaign, where the efficacy seems to be reduced after 5-6 months? So there is no clear evidence because Israel started by vaccinating the most fragile age groups, especially elderly people. And then there is an extension of the Green Pass to 12 months. Do you have a strategy that is ready for the third dose, for the third booster? Does it not contradict the extension of the Green Pass? Well, we are following up on the evolution of the situation from all countries of the world, and we are generally looking at the ones that started before with their vaccination campaigns. So Israel is one of them, and also the United States of America, the UK. These countries started some weeks earlier with respect to Italy in their vaccination campaign. So it's clearly we are observing them with great attention. The third booster in Italy will take place. We will start already in September for people who are fragile in terms of their immune systems. So, for example, some categories of oncological patients, patients undergoing transplants, or categories of people who have a fragile immune response to the first 2 doses. I would like to say that the EMA and the CDC have expressed their opinion. So in September in Italy, we will start with the third booster. And then we'll go on analyzing the data, but very likely the third dose campaign will continue, trying again to look at fragility first. So the older people above 80 years of age, those who live in residential homes. So Italy paid a high price in these facilities, so we have to protect them. The same holds true for health staff. So these are the first categories that receive the vaccine. Probably we have to start from them. So our facilities, our institutions will provide their opinions, but I believe that already in September we are going to start the campaign. Then a question from Mr. Gero. Good afternoon. 2 flash questions. One on the third booster. There is not a contradiction saying that we have to try and help countries that have not been vaccinated by increasing supplies to these countries, and the other, and the richest countries are going to use a third booster. And the third booster, are we sure that is going to be used for healthcare professionals, to fragile people? Will it be necessary for all the other categories? A final question. I've noticed that sometimes negative messages are being conveyed. If we do not, if you're not vaccinated 80%, we will go back to lockdown. Maybe we should give a different message, a positive. If we manage to arrive at 90% of vaccination, we can give up limitations or green pass or lockdowns. I believe that we have to do these two things together. So we cannot reduce the level of protection that we have reached in the countries where we are advanced with our campaign, because stopping means going back and also wasting our investments. And at the same time, we have to launch a great campaign in other parts of the world. So these are mutually supportive and they're not mutually exclusive. So great determination as to communication we can discuss, but there is one basic finding. So in Italy, in August, there were very, very few restrictions. Now, August is over. Most people were able to rest or go on holiday. Generally, life was very different this month with respect to what we had in the past, where we had very strict restrictions. This happened, first of all, thanks to vaccines. That's the truth. So my message continues to be very clear to Italian people who have not been vaccinated yet, those who have been vaccinated, who are going to be called to have a third booster. The vaccine is the key to open the door to a new season, a different season. So we have to go on being vaccinated. Vaccination, vaccination, vaccination. This is a way to win this battle. Thanks to all of you, and the press conference is over. Thank you. Thank you. Goodbye.